Hi, my name is Melanie, and I am going to be presenting on health disparities within the LGBTQ population. Let's get started. So, specifically within the LGBTQ population, I'm going to be talking about those who are same-sex attracted, so gay and lesbian women. It's a very broad and diverse population, LGBTQ, so we've narrowed it down for this presentation just to those who are same-sex attracted and any health disparities that those people specifically face. The recognition of this population as being a valid minority has been a really long and slow progression. From a really long time ago, when people virtually ignored the existence of homosexuals in a lot of cultures, to then eventually diagnosing homosexuality as a mental illness, then to the AIDS epidemic in the 1980s that brought a lot of attention to homosexuality, and with that a lot of negative stigmas as well. There's just been a long and slow progression of people becoming aware of this population and trying to figure out how to best treat them and how to remove prejudices in treating them. This population is just specifically really vulnerable to healthcare disparities because of this long time buildup of prejudice from a lot of different people and groups. Also from a lack of data, because they haven't had as much studying done, as much research on same-sex attracted individuals, because it hasn't been mainstream accepted. So not as much data and prejudice, and because of prejudice, and that's just led to healthcare disparities for them. So the size of this population, there's an estimate. This resource I looked at said 3.5% of individuals in the U.S. identify as gay. That does kind of change depending what source you look at. But from the U.S. Census Bureau, there's an estimate from the last census that came out that 0.8% of households in the United States are same-sex households. And then in Utah, where we live, throughout our state, the average ends up being 0.45% of households that are same-sex households, though that does vary a little bit in the Salt Lake area. The most urban and most populated valley, the part of the state, that number is actually a lot closer to average. It's about 0.78, so almost exactly the same as the national average. So it kind of varies throughout the state of Utah. To talk about reasons why, there is a lot of speculation of why maybe the Utah overall state amount is so much lower than the national average, but there's a very dominant conservative religion, and just it's a conservative state. It's a little bit more rural around the outskirts of Salt Lake of the state, small towns, and in those places, typically there tends to be smaller percentages of same-sex households than in more urban places. So when you look at the Healthy People 2020, they have a list of social determinants of health. The ones that I picked out that would be most affecting of this population, same-sex attracted population, are these ones. So we'll break it down kind of specifically. There's the availability of resources to meet daily needs. This is obviously, all of these fluctuate situation to situation, but sometimes resources can be harder to attain when there are not only built-in prejudices, but just systems that are built more for heterosexual couples. Things as much as even just legal rights of a partner that are changing, but sometimes partners in same-sex relationships have less legal weight, that gives them less resources to just the system not being set up as much for same-sex couples. Access to educational, economic, and job opportunities. This is being improved upon and changed with time, but there have definitely been time and instances when those who were out as gay or lesbian were discriminated against or refused certain job opportunities or levels of education. Healthcare services. This one can be a resultant of other things such as job opportunities, but also a lot of the time with other things, healthcare is just set up for the heterosexual person, and so that is something that is being changed, but there's not a lot of specific care that has been researched and set up for the same-sex attracted individual. The next few all kind of go into the same category, but social support, social norms and attitudes, community resources, all of these can be obstacles for the same-sex attracted person to their health because of prejudices they might meet. It's when you're not feeling socially supported by your family, as many same-sex attracted individuals don't, that can affect your mental health, emotional health, and just social norms. They are changing with time, but social norms often exclude acceptance of same-sex attracted individuals, and that can make it difficult to live a healthy, full, and fulfilling life. So this is a picture of Maslow's hierarchy of needs, and we want to discuss which ones are met, maybe unmet for this specific population. With everything we're talking about, this is going to vary individual to individual and on their specific situations, but often with this specific group of people, the physiological needs may be met. It doesn't typically affect breathing, food and water, homeostasis, etc. But everything above that can definitely be affected for a same-sex attracted individual. So family and property, that can be affected by people discriminating or not treating them the same because of their sexual orientation. Love and belonging is a huge one. There is a lot of friendship and family difficulty for some people when they have to come out and they're not accepted by people who believe homosexuality, it doesn't fit into their moral framework. Esteem is also a big one because a lot of people who are same-sex attracted struggle with self-esteem when they don't feel accepted by their peers, or they don't feel confident being able to be who they are, be themselves in certain situations. And self-actualization is a big one as well, just because it can be hard to be creative and spontaneous and focus on that very tip of the pyramid when so many levels below it are not being met. Also with this, it can affect the functional level of these people, make it more difficult to function on a more fine level of creativity and really flourishing while they may be meeting their most basic needs. If their other needs aren't met, it's hard to achieve your best mental and emotional health. So as far as specific health concerns, communicable disease and infections, the first one that often comes to mind is a big one, sexually transmitted diseases. These can be a higher rate in the gay and lesbian community. Specifically with gay men, they're significantly more likely to contract HIV, but also HPV, hepatitis B, and herpes, just because of anal receptive intercourse, which is more common in this community. That just makes your risk for STDs go a lot higher. But those higher risks can lead to an increased risk of anal cancer with gay men. And then as far as lesbian women, they're more likely to get, they're less likely to get cervical smears, pap smears done, which can lead to an increased risk of cervical cancer. They've also been shown to be slightly higher risk for breast and endometrial cancer. And then the last category is non-communicable diseases, so other health conditions that are more likely for those in the same-sex attracted community. There are definitely higher rates of mental health issues like depression and anxiety, especially among same-sex attracted youth. That has been shown to be significantly higher, which in turn affects suicide rates, which are higher in the population of same-sex attracted. And then along with this, there's a higher risk of high-risk behaviors, high-risk sexual encounters, and behaviors that might in turn be self-harming. And this can be mitigated by education and acceptance and normalization of this population, teaching healthy sexual behaviors and healthy self-acceptance.